If you've ever gone to bed thinking sleep is simple and harmless, I need you to pay attention right now. Because there are nighttime habits that seem completely normal, even healthy, and without realizing it, they may be quietly weakening your heart, night after night. I'm Dr. Marcus Bennett, and after many years working with patients through some of the most critical moments of their lives, I can tell you this with complete clarity. What you do while you sleep matters far more than most people ever consider. Before we continue, if you're serious about protecting your heart with clear, clinically grounded information, subscribe now and turn on notifications. This is the kind of content that can make a real difference in your long-term health. Over the course of my career, I've worked with strong hearts, worn-out hearts, and hearts that gave out far too soon. But there's one case that has stayed with me. It wasn't a smoker. It wasn't someone with a poor diet or a history of neglecting their health. It was a 62-year-old man, I'll call him Robert, who came into the emergency room in the early hours of the morning with a severe heart attack. On paper, Robert was doing everything right. He walked every day, didn't smoke, had his cholesterol under control. His family was devastated and confused. So was he. Nobody could understand what had gone wrong. I went back through his history again and again until a pattern started to emerge. It wasn't what he was eating. It wasn't what he was breathing. The problem was in his bedroom. There was a quiet pattern, a silent threat that was working against him every single night while he slept. What damaged Robert's heart may be affecting yours right now, without you knowing it. As his physician, I felt the responsibility to understand it. And as someone speaking to you today, I feel the same duty to explain it clearly. We're not going to talk about impossible diets or exhausting exercise routines. Today, we're talking about 5 silent sleep mistakes that weaken the heart over time. Pay close attention, because mistake number 1 is exactly what we found with Robert, and it's more common than most people realize. Stay with me until the end. We start with mistake number 5, treating long, uncontrolled naps as harmless. Naps tend to get a pass. A lot of people assume that a long nap makes up for a rough night, but that's where the problem starts. Sleeping more than an hour during the day or napping at irregular times can create real stress on the body. When you sleep beyond 60 minutes, you enter deep sleep. If you're pulled out of that abruptly, what follows is what we call sleep inertia, that heavy, disoriented feeling when you wake up worse than before. It's not just an inconvenience. For the cardiovascular system, it's a genuine physiological stressor. The body releases cortisol and adrenaline to force you awake. In younger people, this barely registers, but in adults over 50 or 60, or in anyone with existing risk factors, these small daily surges accumulate. Research presented at European cardiology conferences has consistently associated long naps with a greater risk of arrhythmias, including atrial fibrillation. Other studies have linked this habit to elevated blood pressure. It's a low-grade jolt to the heart, repeated every afternoon. The solution isn't to eliminate naps, it's to use them well. In my clinical experience, the right call is a short rest, no more than 20 to 30 minutes. That's enough to recover energy without entering deep sleep. And something worth keeping in mind: avoid napping after 3 p.m. Set an alarm. Be consistent. A short nap supports recovery. A long one, repeated over time, tends to work against it. Now, mistake number 4, sleeping in a room that's too cold. This one still catches a lot of people off guard, especially in winter, or in homes where the air conditioning runs all night. You may feel like you tolerate the cold just fine, but your heart doesn't always agree. When nighttime temperatures drop too low, the body has to work to maintain its core temperature. In older adults, That effort is considerably greater because the body's thermal regulation system simply doesn't perform the way it once did. The vascular response is to constrict blood vessels in the limbs to protect the vital organs, and that process raises blood pressure and forces the heart to work harder. If hypertension or any prior cardiovascular issue is already in the picture, this nightly effort compounds as an additional burden. Conditions like diabetes increase this risk further. This isn't a matter of comfort. It's a matter of physiology. The sensible approach is to keep the bedroom between 65 and 70 degrees Fahrenheit. Wear appropriate sleep clothing. And don't underestimate something as simple as keeping your feet warm. It's a well-recognized pattern. Maintaining peripheral circulation stability at night gives your heart less to compensate for. We've covered two very common mistakes. If you recognized yourself in either of them, that's actually a good sign. Because awareness is where change begins. If this is helping you think differently about your heart health, subscribe and turn on notifications. Every video here is built around the same goal, giving you practical, science-based guidance you can actually use. We move now to mistake number 3, one of the most frequent patterns I see: irregular sleep schedules. Going to bed and waking up at a different time every day, particularly on weekends, creates more disruption than most people expect. Inside your brain, there is a master clock, a biological regulator that governs hormones, body temperature, digestion, blood pressure, and heart rhythm. That clock depends on consistency. When you go to bed early one night, late the next, and at a completely different hour the day after, it's the equivalent of giving your body constant jet lag, without ever leaving your time zone. This internal disorganization has been clearly linked to greater cardiovascular risk. Irregular sleep patterns are associated with increased blood pressure, systemic inflammation, and arterial stiffness, conditions that create an environment the heart has to work against. Think of the heart as a musician in an orchestra. To function well, it needs a steady rhythm. In the next segment, we'll keep going, because the mistakes still ahead are even more common. And if you've made it this far, your health clearly matters to you. When the conductor of that internal orchestra, your biological clock, changes tempo every night without warning, the musician loses the beat. That's exactly what happens to your heart when your sleep schedule is chaotic. It's under constant low-grade stress, without ever getting the stability it needs to fully recover. The solution may sound straightforward, almost boring, but it's one of the most powerful decisions you can make for your cardiovascular health. Establish a firm sleep schedule. Go to bed and wake up at the same time every day, including weekends. For most adults, 7 to 8 hours is what the evidence supports. If you need to shift your schedule, keep the change within 1 hour. That regularity acts as a biological anchor, and it gives your heart the predictability it needs to truly rest. Now, we arrive at mistake number 2, one of the most dangerous, and still one of the most dismissed: ignoring snoring and pauses in breathing. It's easy to laugh off heavy snoring, to treat it as a minor annoyance for whoever's sleeping nearby. But it's a pattern I've watched play out more times than I can count, and the consequences are anything but minor. Loud, persistent snoring, and especially pauses in breathing, can be a clear clinical signal of obstructive sleep apnea. This condition occurs when the throat muscles relax during sleep enough to block airflow, and breathing stops, sometimes for 10 seconds, sometimes 20 or more, and it can happen dozens or hundreds of times in a single night. Each pause drops oxygen levels in the blood. The brain registers it as an emergency and triggers a micro-awakening to restart breathing. It's a continuous stress cycle. For the heart, this means repeated spikes in blood pressure and surges of stress hormones that force it to work far beyond what normal sleep should require. This isn't real rest. Sleep apnea has been consistently associated with difficulty controlling blood pressure and with meaningfully elevated cardiovascular risk. What makes it especially concerning is that most people don't know they have it. They think they're just heavy snorers. That was Robert's situation. His wife had noticed him stopping breathing during the night, but they chalked it up to fatigue. They didn't understand that every one of those pauses was placing a direct burden on his arteries. The clinical consensus is clear. This needs to be taken seriously. If someone has told you that you snore loudly, stop breathing at night, or if you wake up with a headache, a sense of gasping or profound exhaustion despite spending hours in bed, talk to a physician. A sleep study can be genuinely informative. Effective treatments exist that improve sleep quality significantly and reduce these risks. This is not the place to wait and see. And now we arrive at mistake number 1, the most common, the most normalized, and the one that, combined with other factors, was central to Robert's story: sleeping too little or sleeping in a fragmented way. Getting fewer than 7 hours of sleep or waking repeatedly through the night has become almost standard in American life. We've built a culture that treats sleep as optional, as something to sacrifice when there's more to do. But the body doesn't function on that logic. The evidence has been consistent on this for years. Insufficient sleep is directly associated with elevated blood pressure, vascular changes, and a chronic state of low-grade inflammation. During deep sleep, the body enters a genuine repair phase. Blood pressure drops naturally. The heart gets the recovery window it requires. When that window disappears, or is interrupted over and over, the heart loses its restoration time. Pressure remains elevated. The system stays in a state of alert. Fragmented sleep, waking repeatedly from noise, anxiety, or trips to the bathroom, carries a similar impact. The total hours in bed don't tell the whole story if the rest was never continuous. Robert had a demanding job. He was sleeping 5 or 6 hours a night and woke up exhausted most mornings. He assumed it was just aging. What he didn't realize was that the sustained sleep deprivation was keeping his body in a state of constant physiological tension, and his heart was bearing the cost. The answer, while not always easy to achieve, is to treat sleep as a non-negotiable part of your health. Not a luxury. A clinical priority. Aim for 7 to 8 consecutive hours. Protect your sleep environment. Reduce screen exposure before bed. Keep the room dark, quiet, and at a proper temperature. If sleep consistently isn't coming, find out why. Don't normalize it. Let's bring it together. Long, uncontrolled naps. Bedrooms that are too cold. Irregular sleep schedules. Dismissed snoring and pauses in breathing. Chronic sleep deprivation. These aren't just bad habits. They're modifiable risk factors with real cardiovascular consequences. And that's not opinion. That's what the data shows. The good news is that every single one of them is within your control, and you can begin addressing them starting tonight. As for Robert, he made it through. It was a hard and frightening wake-up call. Alongside his medical treatment, we worked to improve his sleep from the ground up. He committed to a consistent schedule, started treating his sleep apnea, and made deliberate changes to his sleep environment. Over time, his energy returned, and today he lives an active life with a much clearer understanding of what actually kept his heart safe. His story didn't have to end that night, and yours doesn't need to wait for a scare to begin either. Start with one change tonight. Pick the mistake that resonates most with your own routine and work on it. Which of these habits do you recognize in yourself? Leave it in the comments. Those conversations matter more than most people realize. If you've made it to the end, it's because you take your health seriously. Subscribe and turn on notifications. We'll keep talking about how to care for your heart with information that's clear, grounded in real clinical experience, and built to actually help you. Taking care of your nights is one of the most meaningful decisions you can make for your long-term well-being.